Hi, this is Dr. Michael Brisman, neurosurgeon from Long Island, sharing with you some of my interesting cases. I treat a lot of patients with acoustic neuromas, benign brain tumor of the eighth cranial nerve. Usually we try to do management with Gamma knife. In rare cases, we see patients who have bilateral acoustic neuromas. That is to say, they have acoustic neuromas on both sides, and this is from a genetic disorder called neurofibromatosis type 2 or NF2. So I'm showing you such a case right now. So this is a 26-year-old patient of mine who had bilateral acoustic neuromas. The right one, in this case, was much larger than the left, and she had symptoms from the right one. She had significant decrease in the right ear hearing. It was about 10% of normal. And she had other benign lesions in the rest of her body that we did radiosurgery on at separate times. But this was the session for treating her. We planned to treat Gamma knife for her, and Gamma knife can be a very effective treatment even for bilateral acoustic neuromas. Again, these patients used to have bilateral craniotomies, would often lose hearing, have problems. But this was a Gamma knife, one-day outpatient, minimally invasive treatment. We did the Gamma knife. She went home the same day. This is showing the treatment. The yellow is the 50% isosceles line. The 40% isosceles line is showing green, again, showing rapid fall off. The larger tumor was significantly indenting into the pons and cerebellum and the cerebellopontine angle. And we don't treat both at the same time. And the left one was pretty small, so we left that at the time of the first treatment. And this is, she did very well. This is an image 6 years later. And it shows that the right acoustic neuroma, is essentially cured. I mean, dramatically shrank, is just some inactive scar tissue. Of interest, I mean, this is one of those rare cases where the patient's hearing really got a lot better. Her hearing pre-op was maybe 10% of normal, was hardly anything. And at long-term follow-up, she's had about 80% of her hearing in the right ear. Now, of interest, on the other side, the left acoustic neuroma had grown somewhat over those 6 years. So we did subsequently do another Gamma knife of the left side, and she did well from that as well. But sometimes we, may have to do Gamma knife for both sides, although not at the same time. But I think Gamma knife is a nice option for younger people, and it's a nice option for people with bilateral acoustics and NF2. Again, a pretty minimally invasive way of treating this. For a disease that we used to have to treat with bilateral craniotomies, which had a lot of morbidity. So thank you for hearing about this interesting case.